Hi, this is Stevie with Maryville University, and I am performing my head and toe assessment. I have Brett here. He's agreed to be my patient, and we are going to begin. Before having Brett gown, I had him empty his bladder. His vital signs were taken, as well as his height and weight. We also did the Snellen and Rosenbaum vision screenings, and he was given the option to either have a gown or to dress comfortably. So we're just going to begin with all patients. As they walk into the room, I always assess their mobility, their manner, and their dress to make sure everything is appropriate. And then I begin an inspection, and I begin with the head, making sure that all the facial features are symmetric. I'm inspecting his head to make sure there's no bulges or visual trauma, lesions, nodules, anything like that. I inspect his scalp, and it is freely moving. I'm just taking note of his hair color and the distribution, make sure that it's even, and it is on both sides. And then I'm going to move on. I'm going to go ahead and assess his TMJ, and I'll have him open wide and close, and I'm assessing for pain or crepitus here. And I'm going to move on to his eyes. I'll just visualize both eyes, making sure they're symmetric. I'll palpate the eyebrows to make sure there's no nodules or lesions, no pain or anything. Go ahead and open your eye. I will look here at the conjunctiva, and it is pink. It's not red or yellow or pale. I'm making sure both pupils are equal. They're round, they're reactive to light, and then I'm going to test for accommodation. Go ahead and look on the wall, and now my pen light. And good. So pupils are equal, round, reactive to light, and show accommodation. I'm also going to palpate the lacrimal apparatus, just making sure there's no pain or tenderness, there's no redness, no extra tearing or dryness. Everything looks good there. And now I'm going to palpate his lymph nodes. We'll start with the preauricular, postauricular, submental, just look normal, submental, submandibular, tonsillar, occipital, superficial cervical, deep cervical, posterior cervical, supraclavicular, and I'm going to erase your arms to the sides, and we'll also palpate for axillary lymph nodes. And no nodules or tenderness there. I'm going to move on to his ears, and we're just inspecting the ears to make sure there's no lesions. Everything looks good here on both sides. Palpating the pinna. We'll look at the tympanic membrane, and it looks good. And then we're going to move on to the nose. I'm just making sure that the septum is not deviated. There's no masses, lesions. The skin looks fine on the nose. There's no visual drainage. I'm going to look inside the nose and inspect the turbinates. They're not red or swollen. There's no nasal polyps, no visual discharge. The hair is evenly distributed. So that looks good. And we'll move on to the mouth, which I would glove if it were my patient. And I would just kind of palpate around after inspection. Everything is pink and moist. It looks fine. I'm going to go ahead and have you open. And I would inspect the buccal mucosa. I would look at the teeth, make sure there are not any teeth missing. There's no visual cavities. The tonsillar pillars are 2+. There's no exudate on the back of the pharynx. The uvula rises midline. The tongue is pink and moist. I'll look at the dorsal side of the tongue and for oral cancers, as well as both lateral aspects of the tongue, and that looks good. So now we're going to move on to the cranial nerves. then for cranial nerve 1, I would have the patient identify a familiar smell like vanilla or chocolate or something, and make sure that the smell sensation is intact. That's the olfactory nerve. Cranial nerve 2 is the optic nerve, and we would perform the Snellen and Rosenbaum vision screening tests, which we did prior to exam. Cranial nerves 3, 4, and 6 are assessed together. That's the oculomotor, trochlear, and abducens nerves, and we'll do those screenings right now. I'm going to have you cover your right eye and uncover, and cover your left eye and uncover, and we're looking for strabismus here, and that test was fine. Then we're going to do the cardinal fields of gaze. Have you look at my pen light without moving your head, just move your eyes, follow my pen light. And that's good. No nystagmus was noted. He was able to follow my pen light through all fields of gaze. And then we're also going to do the confrontation test. And kind of tilt towards me so the camera can still see. Okay, cover this side. And just tell me when you can see in your peripheral vision.
No.
Don't move your eyes though. Look straight at me.
No.
Okay. And one, two.
No.
Good.
No.
And
No.
And we would do that with both eyes. So that tests cranial nerves 3, 4, and 6. Cranial nerve 5, the trigeminal nerve, we will do a light sensation test. Just tell me where you feel the sensation. Go ahead and close your eyes.
Forehead. Chin. Cheek.
Good. And then clench your jaw for me. Good. So that tests cranial nerve 5, the trigeminal nerve. It takes us to cranial nerve 7, which is the facial nerve, and we will have the patient wrinkle his forehead. Wrinkle your forehead. Close your eyes. Puff your cheeks. Good. That is cranial nerve 7, the facial nerve. Taking us to cranial nerve 8, the auditory nerve, and we would have the patient, we'll do the whisper test first. Just look straight ahead and just cover this ear and repeat after me.
Orange.
And cover your other ear and repeat after me.
Banana.
And then we will also do some assessments using our tuning fork. The Weber test, I strike the tuning fork and I place in the center of his head. Tell me if you hear in your right ear, your left ear, or both ears.
The same. Both.
So there's no lateralization. And then for the Rennie test, we strike the tuning fork and we place on the mastoid bone. Tell me when you can no longer hear the noise.
No.
Then right in front of the external auditory canal. Tell me when you can no longer hear the noise.
No.
And bone to air conduction should be 1 to 2. So that tests the auditory cranial nerve. That takes us to cranial nerves 9 and 10, the glossopharyngeal and vagus nerves. Is that right? Yes.
Mm-hmm.
Okay. Glossopharyngeal and vagus nerves 9 and 10. And to test that, we will we could assess taste here. So I would give him something familiar to taste. And we would also make sure that the uvula is midline. So say ah. And we're inspecting the hard and soft palates here as well as making sure the uvula is midline. Which takes me to cranial nerve 11. This is the spinal accessory cranial nerve, and we're just going to have today the patient raise shoulders against me, good, and turn against me, good, here and here. That's cranial nerve 11, and cranial nerve 12 is the hypoglossal cranial nerve, and we'll just have the patient make sure that his tongue protrudes midline. Good. Okay. So that concludes the cranial nerve assessment. We're going to move on to the neck now. We're going to just inspect the neck, making sure that there's no goiter, nodule, or any visual trauma. The neck rests midline from anterior and lateral views. We're just going to palpate the trachea here, just look normal. And it is midline as well as the thyroid gland. Push this to the side and palpate here for goiter. And then we're going to auscultate for bruise using the bell. Overcrowded on the left side and right. As well as over the thyroid gland. Okay. So the neck looks good. And now we're going to move to the, let's go back and do the sinuses. We'll palpate both frontal and maxillary sinuses. And here you're wanting to know if there's any tenderness or if you feel any fullness. And that looks good. Now for the upper extremities, we'll just inspect to make sure there's no rashes or lesions or visual trauma. With the back of my hand, I'll check the temperature and it's warm, everything's moist, hair is evenly distributed, the capillary refill is good, skin turgor is good, and you check this on both sides. You can also check now for pulses, both brachial and radial, and you compare these bilaterally. That's good. And then we're going to move on to the chest. We're going to just inspect the chest to make sure everything looks normal. Noting his hair distribution is even, there's no trauma, rashes, lesions, nodules. With the stethoscope, we're going to listen for heart sounds. And over the second intercostal space, right sternal border in the aortic area, pulmonic area, second intercostal space, left sternal border, Erb's point, third intercostal space, left sternal border, tricuspid area, fourth intercostal space, left sternal border, and then the mitral area, which is mid-clavicular line, fifth intercostal space, left on the left side. And that all looks really good. Let's do making sure there's no lifts or heaves. You could also palpate over the precordium and making sure the rate and rhythm are equal. And then I'm going to move on. I'm going to have you lay down. And I'm going to just listen for lung sounds here after inspection. I'm also looking at his abdomen to make sure, I'm taking note if it's concave, convex, and if I can see any movement. And I'll just listen to breath sounds now. And we're just making sure that there's no adventitious breath sounds. And I compare breath sounds bilaterally. And I will do the anterior lungs as well as both lateral aspects of the lungs. And then we're going to do percussion over lung tissue. And that all sounds really good. Okay, let's move on to the abdomen, and we're going to, I've already inspected, so I will auscultate now, bowel sounds in all 4 quadrants. And you can wait up to 2 minutes if you don't hear any bowel sounds, but we're trying to rule out hyperactivity and hypoactivity. And then with the bell of my stethoscope, I'm going to listen over his arteries. First the carotid, ruling out any bruise, then renal, iliac arteries, comparing bilaterally, and femoral arteries. And then I will just softly palpate over the carotid to make sure that there's no lifts or heaves and the rate feels normal. Okay, so after inspection and auscultation, then I will do percussion and bowel sound, or this should be tympanic. It will be dull over a full colon or over an organ or a mass. So we're ruling out a mass here. After percussion, I will do a light palpation. And no tenderness or masses should be felt. And then we repeat using deep palpation. Okay. And we're also going to test the abdominal muscles here. And I will just go one side, and the umbilicus deviates towards the side that I'm touching. So that all looks really good. Now I'm going to palpate for the spleen and the liver, starting with the liver. And I'll just have you take a deep breath. Hold it. Take a deep breath and hold it. And then go ahead and release it. And I'm seeing if the liver slides underneath my fingers, which it does not. And the same for the spleen. And release. And I'm unable to palpate either the liver or the spleen, which is usually good. And now we'll do percussion for the liver. And I'll start up here, waiting to hear it change from tympanic to dull, and then I'll mark that spot. And I'll start down at the umbilicus and work up, going from tympanic to dull, and I'll mark this spot. And at the midclavicular line, the liver span should be between 6 to 12 centimeters. For the spleen, around the 6th to 9th vertebrae, you should hear some dullness. It should not last more than about 3 intercostal spaces, or we might have an enlarged spleen. And that all looks really good. I'm going to go ahead and do tactile fremitus. If you could say 99.
99, 99, 99, 99.
Checking here for tactile fremitus
99,
on both anterior and lateral aspects.
99.
And that all looks good. Okay, I'll have you sit up and just face that way a little bit. Let's do your back. So if you go ahead and spin your legs all the way around. And then if you'll face this way so the camera can still see you. That's good. So I will do an inspection of the back and making sure it's symmetric. There's no rashes, of course, lesions, nodules, anything abnormal to appearance. And then I will auscultate his breath sounds. And I'll have the patient inhale and exhale as I compare breath sounds bilaterally. And we'll just do the posterior side because we've already done the lateral. So we're checking to make sure there's no adventitious breath sounds. We are going to percuss over the costovertebral angle to make sure that he's not having tenderness. I'm going to have him exhale and then take a big deep breath. Now big deep breath and release. And my thumbs move apart evenly for the thoracic expansion. And then we will measure diaphragmatic excursion. So I'm going to have the patient take a deep breath and then exhale out as far as you can. And then we will mark this spot. And then go ahead and take a deep breath and hold it. Good, and then we mark this spot, and this should be about a 3 to 5 centimeter range. Okay, that all looks really good. I'll go ahead and have you turn back around. And now I'm going to inspect my patient's lower extremities. Just taking a glance here, there's no rashes, the hair is evenly distributed. I would check the temperature and it should be warm, making sure there's no edema on either side. Checking for turgor, checking for capillary refill on both sides. Everything looks good there. We'll check the popliteal pulses. And posterior tibial. And dorsalis pedis. Good. And now we're going to check some reflexes. We'll do the brachial reflex. I'm just going to have you really relax your arm there. Good. We would do this on both sides as well as the knees. Good. And the Achilles reflex. Good. Belly reduction. Good. And the Achilles on this side. Good. All of that looks really good. We're going to test the strength of the musculoskeletal strength. We're going to have you do your arms like this. Don't let me pull away. Good. And don't let me push away. Good. And now out to your sides like this. Don't let me push them down. Good. Don't let me pull them up. Good. And your fingers out. Don't let me push them together. Good. Don't let me push your leg back. Great. And don't let me pull it out. Good. And we'll assess this on both sides. Good. And flex your foot. And don't let me push it down. Great. On both sides. So all of that looks really good. And this concludes our head to toe assessment.